Have you ever been treated for a lung infection, felt better for a while, only to have the symptoms return again and again? Sometimes the reason isn't that the antibiotics failed, it's because a particularly stubborn bacterium called Pseudomonas aeruginosa has found a way to persist in the lungs. Pseudomonas is a gram-negative bacterium that is well known for being resistant to many antibiotics. It can also produce protective layers called biofilms, which act like a shield, making it much harder for both antibiotics and your immune system to completely eliminate the bacteria. Not everyone is at risk for chronic Pseudomonas infections. We most commonly see it in patients with bronchiectasis, COPD, cystic fibrosis, advanced structural lung disease, or weakened immune systems. Frequent hospitalizations and repeated antibiotic use can also increase the risk. So, what symptoms should you watch for? Patients often develop a chronic cough, increasing amounts of thick green or yellow mucus, worsening shortness of breath, fatigue, wheezing, chest discomfort, or even occasional coughing up blood. If these symptoms continue despite treatment or keep returning, it's important to look for an underlying cause rather than repeatedly prescribing antibiotics. Diagnosing Pseudomonas is usually straightforward. The first step is obtaining a sputum culture, which tells us exactly which bacteria are present and which antibiotics are most likely to work. If someone cannot produce sputum or the diagnosis remains uncertain, a bronchoscopy may be performed to collect samples directly from the lungs. Treatment can be challenging because Pseudomonas is naturally resistant to many commonly prescribed antibiotics. One of the most effective oral options when the bacteria are susceptible is ciprofloxacin, a fluoroquinolone antibiotic. However, these medications can have significant side effects, including tendon injuries and nerve damage, so we carefully weigh the risks and benefits before prescribing them. For patients with recurrent infections or those who cannot tolerate oral fluoroquinolones, inhaled antibiotics such as nebulized tobramycin may be an option. By delivering the medication directly into the lungs, we can achieve high concentrations where the bacteria live while limiting exposure to the rest of the body. One of the most important parts of treatment has nothing to do with antibiotics. Effective airway clearance is essential. When mucus sits in the airways, bacteria have an ideal environment to grow. Chest physiotherapy, oscillating positive expiratory pressure devices, nebulized hypertonic saline in appropriate patients, regular exercise, and effective coughing techniques all help mobilize mucus and reduce the frequency of infections. It's also important to understand that chronic Pseudomonas is often a sign of underlying structural lung disease, especially bronchiectasis. The infection itself can create ongoing inflammation that further damages the airways, leading to a cycle of mucus retention, infection, and more inflammation. That's why successful treatment focuses on both eliminating bacteria whenever possible and improving mucus clearance over the long term. So here's a question for you. If you've had repeated lung infections over the past year, has your healthcare provider ever ordered a sputum culture to find out exactly what's causing them? As always, if you're experiencing frequent respiratory infections or a chronic productive cough, talk with your healthcare provider. Identifying the underlying cause early can lead to more targeted treatment and may help prevent further damage to your lungs. Thank you for watching, and if you found this video helpful, consider sharing it with someone who might benefit. I'll see you next time.